Well, India's healthcare landscape is at a tipping point as we battle a dual burden of lifestyle diseases and communicable illnesses. It's no longer enough to just treat what is visible. We understand that prevention is emerging as the first line of defense, but what does preventive healthcare truly mean in a country like ours where access, awareness and affordability remain huge barriers? We have with us Dr. Ashutosh Raghuvanshi, who is the MD and CEO of Fortis Healthcare. Thank you, Dr. Raghuvanshi. My first question to you, sir, I was looking at some of your interviews, and you have been focusing a lot on preventive healthcare. What does this mean in the Indian context? Because in India, we often look at hospitals as places you go to when you fall ill. How has that shift really reflected in the operational style of hospitals like yours?
Yeah, I think there are two parts to this question. And the first one is that most of the systems around the world are designed around illnesses and hospitals. Curative health is where the focus is. And it is not unique to India, but it's all over the world. And the focus has always been on that side. However, I think in a country like India, where there are two diverse sets of population. We have a rural population which is suffering not only from the exposure to communicable diseases, which are still there. There is still a significant burden. They are also having non-communicable diseases. Incidence is increasing as well at the same time. And at the same time, the urban population where obesity and such things are becoming a real-time problem. So in a country like India, if you look at our healthcare budget, and if we focus that entire budget on the curative side of this, we simply cannot afford as a nation. If you look at the American expense on healthcare, which is about some 16-17% of their GDP, which is 5-10 times more than what India's GDP is, and our population is much more than theirs. So that means we simply don't have the resources to try and treat all people. Okay. So prevention is an important part. Having said that, prevention is not something new. Preventive medicine has been there for a long, long time. And that's precisely the reason why the incidence of communicable diseases has come down around the world. And there are phenomenal examples. Polio is one glaring example, but there are several other examples of where the preventive part, especially the vaccination part, has, though nowadays, you know, there are a lot of vaccine naysayers as well. But at the same time, I think what has been achieved is phenomenal. Right. And we have gone quite ahead in terms of prevention. But different levels of prevention, primary, secondary, tertiary, are required. In India, different set of populations require different set of preventive measures. Right. And as I was listening to the previous panel, and there is so much of information around, but all that information is not getting channelized somehow, and it's not becoming actionable at an individual level. Yes. So I think we need to focus on that. As far as institutions, especially the private healthcare is concerned, I think there has been a lot of focus on developing preventive care. As we talk further, we can talk about it.
Dr. Raghuvanshi, how does a household prepare for preventive care? Because I'm touching 40s, they tell me that, you know, screenings are very important, but you know, when this whole transformation from a reactive healthcare society to becoming conscious about how can you prevent your own illnesses, how does a household or a family prepare for something like that?
जब गर्मी में हो पसीने का अटैक, don't worry, Technospore has got your back. So this summer, no sweat, no stress, Bask Cotflex.
I think if children are taught about self-care and other measures of good health, like prevention, cessation of smoking, taking care of obesity, diet, exercise, all these things, if they are emphasized to children and they understand the importance of it, they carry that message. They grow with it. They take that message to the families. They are the ones who actually are the decision makers.
Right.
In homes today, it is children who decide what has to be cooked. So I think that is going to be a big thing in increasing awareness.
Right. Dr. Raghuvanshi, there's one more word that we keep hearing, and that's wellness. How do we become a society that's, conscious about the diseases that it has, to being a society that is also very, conscious about the aspect of wellness? What are you doing in Fortis Healthcare to bring in that concept? Because when we look at hospitals now, they're becoming happy spaces. You see a lot of diagnostics. There's data that is explained to you. How do hospitals or private healthcare spaces become happy spaces for people to bring in more positivity and not just look at fixing the problems in their bodies?
Yeah, I think that is very important. Wellness is the concept which private healthcare is adopting more and more in different formats. So we also are doing our bit. And in that regard, we have identified few key areas which we think are very, very important and which are underserved as well. So mental health is one such very important area for us. And we have done several measures there. Again, there we have done a school mental health program, which we have been doing for years. We run a yearly quiz on mental health, which has been going on for now, I believe, about 8-9 years. Children participate from all over the country. So the awareness about the mental health increases by that. So that is one of the major initiatives, which is our social initiative, which we do. But other than that, we are also creating an online platform, which is for counseling for people. Which is not for treatment, but for counseling when people need to talk and they want that kind of support. That is available 24/7. And the third one which we are doing is to create infrastructure, physical infrastructure, which is for the patients who require interventions in mental health space. So that is one area which we are working for. Other than that, we are creating the wellness centers in all our hospitals. One of the areas in the diagnostic is the genomic sequencing, which is a good predictor of a lot of diseases one may have in future. And that can give rise to a specific preventive plan for an individual, a personalized preventive plan for an individual. So we have this next generation sequencing, which can give the report the same day, so that increases the kind of probability of preparing a kind of personalized plan for an individual. And then we are working on several other preventive checks and all. One of the things which I feel is that the blood tests which are done in a package as a regular check program, those at a point of time have no meaning. So linearity of data is important. So that, I think, is one thing which our national health mission, the digital health mission, would facilitate, because then the linear data will be available, and that would give rise to a more predictive analysis of what the future may hold for a person.
Dr. Raghuvanshi, we also believe that preventive healthcare has a lot of tech-driven approach to it. We have a lot of wearables now. We use smart devices. How does this intervention of technology also help individuals understand the importance of preventive health? And is there data to prove that, because you're using some of these smart devices, has it really helped us to counter some of these lifestyle diseases?
Definitely, there are real case studies on at least 2 areas which I would like to mention, or rather 3 areas. One is heart arrhythmias, abnormal heartbeat. There, these devices and the continuous monitoring of that, the remote monitoring of the data, has given rise to a lot of prevention of a lot of deaths and a lot of hospitalizations. Similarly, for patients who have chronic liver failure, if they are monitored with some variable and some other blood parameters, etc., on a linear basis, that data can also be automatically give information where hospitalizations can be prevented. And third area is in cases of heart failure, where again this kind of monitoring will help, and in renal failure, for example. But these are disease-specific examples of people who are having the disease. Other than that, the variable is generating lots of data, but that data is going into a black hole.
Okay.
It's not really giving any actionable information most of the time. People are self-interpreting it and making their own conclusions. So I think this ecosystem will develop. Remote monitoring is definitely something which is going to make a lot of difference in geriatric populations, and in younger populations, performance athletes and those areas, it can make a phenomenal difference. So the linearity of data and the data being interchangeable and also being interpreted is important. Okay. But I think with AI becoming an important tool, that ecosystem will develop very soon.
Dr. Raghuvanshi, also what would you tell a lot of people who use AI, ChatGPT to understand what's happening to them, when it comes to preventive healthcare? What is the red line that they need to draw for themselves?
I think one has to understand that these tools are not yet there. They do give an indication, but that indication could be wrong also. At the moment, at the best, you can get 60-70% accuracy, not beyond that, and sometimes even less. Because ChatGPT is going to give you analysis based on what inputs you give. So if your inputs aren't correct, your output is not going to be good. So it's not the limitation of ChatGPT, but it is also the limitation of inputs. At the same time, the tool is a self-learning tool. Yeah. So the more people seek information from it, the more accurate it will become. So at the moment, I feel that its role of artificial intelligence is only in assisting doctors in making diagnoses or getting to some conclusions. But for patients to self-manage based on ChatGPT is a little risky at the moment.
Do you see a lot of patients coming to you after looking at what ChatGPT is telling them? Do you have to face those challenges of telling them that this is not entirely correct and I'm here, I'm going to tell you what is important?
Yeah, I am not in clinical practice at the moment, so I don't have personal experience like that, but I do keep hearing all the time that this happens, people come with their symptoms. But an aware patient is always better than a patient who is not aware. So I don't think it is a negative that people are doing research on their symptoms on Google and ChatGPT or whatever other tools they might use, because that means they are taking care of their health, and wellness becomes an important part of that. Right. So I think an aware patient is a better patient.
Okay. Dr. Raghuvanshi, also, a wellness-driven approach, does it work for big hospitals like yours? Because a lot of it is dependent on patients who are ill, who have these severe illnesses. How has it worked for Fortis Healthcare, the shift of going to preventive healthcare from something like, just say, that was centered around illnesses?
So it is not binary that you do preventive care or you do only curative care. Both the areas are equally important. And both will be required. As I was saying earlier, that preventive care has been there for a long time, but it has to become more focused. I think both have to be done. For private setups, it is a challenge to decide because there are commercial interests, etc. However, it is a moral and social imperative on the healthcare industry. Unfortunately, we call ourselves healthcare industry, but we only focus on illness. That should not be the case. We should be focusing on good health.
That's very important. Focus on good health and wellness. While we wrap out of this conversation, we look forward to a 5-part healthcare series featuring Fortis Healthcare on NDTV soon. Here's a look at this partnership which promises to decode the evolving healthcare sector where prevention is no longer a choice, it is a necessity, and wellness is priority, like Dr. Raghuvanshi also said. Let's have the logo now. Dr. Raghuvanshi, what are your thoughts on this logo and on this partnership? And also, something, a collaboration like this, how important do you think it is for the realm of preventive healthcare?
No, this is extremely important. I think NDTV has been the path breaker. We had earlier a relationship on the organ donation for many, many years. And I think this relationship will continue. I think media's role is very, very important. It brings it into the focus, and it is the information which is reliable information. So that makes it even more valuable.
Absolutely. Thank you so much. Mainstream media is a reliable source of information, and like Dr. Raghuvanshi says, that one has to be really careful when it comes to tools which are still evolving. As we close this conversation, one thing is clear. Healthcare is no longer about hospitals, but it's about habits. Fortis Healthcare, in collaboration with NDTV, brings you a 5-part healthcare series that unpacks this evolution from illness to wellness, from reactive to preventive. Join us as we decode how India's healthcare is not just healing lives, but also empowering them. Thank you, Dr. Raghuvanshi.
It gives me immense pleasure to invite Srimati